I'm Sue Waltermeyer, and I'm a certified child life specialist at Cure for the Kids. So child life is one of the newer fields in medicine. It certainly doesn't have a long history as physicians or nurses, but our field started as a result of children's healthcare practices in the 1920s and 30s. And if you look at vintage pictures or film from that era, you see children's hospitals were these very big wards that were white walled and white floored, and they had steel cribs and beds with white sheets, and they had nurses that were in white uniforms from head to toe. And it was a very sterile environment. And during that period of time, children were hospitalized for things that we would never consider hospitalizing kids for now, like eczema, or if they had their tonsils out and they might be in the hospital for a couple weeks. And the practice in that time was not really to tell children why they were going to the hospital. Parents were just encouraged them to drop them off at the hospital and come back on Sunday afternoons for a 2-hour visiting period. And so what they were finding is that kids that were hospitalized during this period of time were having a lot of psychological trauma from their hospital experience. A woman named Emma Planck, who was born in Austria and had trained with Anna Freud and Maria Montessori there, immigrated to the United States in the 1930s and got a master's degree in child development and went to work as a professor of child development at Case Western. She was a friend of a pediatrician named Dr. Robbins, who worked at City Hospital in Cleveland, and he asked her in the early 1950s to come and work in the hospital. And so Emma Planck is really the first known child development specialist to go into the hospital and look at the hospital experience from the developmental perspective. And it was really Emma's work and observations and her prolific writings about children's experiences in hospitals that started to sort of change the way we took care of kids in the hospital. Emma and some other forefront people in children's health care, T. Barry Brazelton, a very famous pediatrician, a group of physicians and nurses and social workers, and Emma started an organization called the Association for Children's Hospitals. And it was this organization that really started the wave of change in our country on how we take care of kids in hospitals. They were the ones who sort of developed the idea of the philosophy of family-centered care, that you can't really take care of a child outside the context of their family unit. If you imagine that a family is like a mobile, and one piece of that mobile starts to spin, it upsets the balance of that whole mobile. So that child who's sick upsets the balance of the whole family. So family-centered care looks at the whole family. What are their resources? What are their support systems? What are their beliefs? And addresses the child's healthcare needs based on that framework. So the Association for Children's Health Care, which is what it was later changed to, started a lot of changes in hospitals. For instance, parents being able to be with their child 24/7 in a hospital was really at the impetus of this organization. Allowing siblings to come into the hospital. Creating playrooms and play spaces for children in hospitals so that they could do normal growth and development activities during their hospital stay. And so Emma, being the pioneer of the child life field, really advocated for someone to be in the medical environment who was not doing anything painful or unpleasant to the child, who was just focusing on their psychosocial, emotional, and developmental needs while they were in the hospital. And so the intent of the early child life specialists was really to try and minimize some of that trauma that children were experiencing in the hospital. But as our field has grown and evolved, we know that not only can we help minimize that trauma, but we can actually help children to develop coping skills that they can use far beyond their medical experience, and that they can be more resilient than a lot of us ever thought they could be in those early years. The longer hospital programs for child life specialists tend to be on the East Coast, and it kind of was a movement that moved west. I happen to have had the privilege of being the first certified child life specialist in Nevada in the early 1990s, and I've been a certified child life specialist for about 35 years. And our whole goal is to help children understand the medical environment, why they are here, what's going to be happening to them while they're here, giving them sequential and sensory information so that they can learn to trust that what we say is going to happen, because You know, when we're silent and don't tell kids what's going to happen, they use their imagination, and often their imagination is much worse than the reality. And then they have anxiety and have trouble coping and maybe trouble cooperating, which can make the whole medical process more difficult. So I'm very proud to be a certified child life specialist and to bring a different perspective to the medical team. There's a meme sometimes that I like to use. It's got Darth Vader and the stormtroopers marching down a hallway, and then there's Big Bird in the middle of the mix. And I sort of perceive child life specialists as being that benign, safe person in a medical team that might be scary to a child who's never had to be in a hospital or a medical environment before and isn't certain what all these people are going to do to them or for them. And so making sure to advocate for the child's perspective of what's going on here and helping them cope with the things that they need to do in order to get through their medical experience in a healthy and whole way.